Hi guys, once again Ijaz Hidayat is with you with new talk and with new session. Today is session number 5 and today we're going to talk about the question is which we get it today is heparin-induced thrombocytopenia. The patients who are suffering the heparin-induced thrombocytopenia, and if patient required to go for coronary artery bypass grafting procedure or any cardiac surgery procedures, can we go for coronary artery bypass grafting without heparin? As you know, for the bypass surgery you require the patient to get anticoagulant, and usually we are using heparin as an anticoagulant for any procedure we require for hard lung machines where we require open heart surgery or bypass surgery. So question is, what is the alternative of heparin in case the patient having heparin-induced thrombocytopenia? So first of all, heparin-induced thrombocytopenia, we need to know what is heparin-induced thrombocytopenia. So actually in a heparin-induced thrombocytopenia, the patient's immune systems starting clotting to patient's platelets in the presence of heparin. The patient who is getting heparin and patients already having a hit in heparin-induced thrombocytopenia. So what is going to be happen? The patient platelets start clotting, and which start decreasing the platelets counts of the patients. So of course we have to stop the heparin, because this patient heparin is not a reliable medicines to keep the patient anticoagulant. So in this type of patients, and we need to think about the alternative of the heparin dose. So we can use in place of the heparin, we can use a direct thrombin inhibitor, such as we have Angiomax, bivalirudin. So today we're going to talk about the bivalirudin, like Angiomax. So instead of the heparin, we can use a bivalirudin drug, and you will get the bivalirudin drugs in powder forms, like a 250 milligram in a powder form, so which can be diluted with the 5 mils as per the guidelines, and then after mixing with the distilled water 5 mils, you can mix this vial into 50 mils, or you can use two vials in 100 mils. So if you're going to use one vials like in a 50 mils, it will be going to 5 milligram per mils. Or if you are using two vials, so 500 milligram in 100 mils, so it will, of course, it will be 5 milligram per mils. So the concentration of bivalirudin Angiomax is like a 0.5 to 5 milligram per mils. So initial dose of the Angiomax bivalirudin drug is like a 0.7 milligram per kg is the bolus you require to give to the patients, and then it was followed by 1.7 milligram per kg per hours. So the target of our ACT level should be, as you know, we are using like a 400 and above seconds as a ACT, and of course we have to go through with our routine protocol to keep the ACT level 400 and above. And if we required, we can request anesthesia to increase the flow rate or pump rate of bivalirudin from the anesthesia side, so that we can keep our ACT level above than 400 to 450 second above than we required, so that we can run a routine and proper adequate bypass procedure, and we keep the patients in routine manners. So now, guys, as you know that for the heparin, normally we once we complete the procedures, we required antidotes, like we required the protamine sulfate to neutralize the heparin function. So normally once you finish your procedures, then the protamine sulfate started, then you decannulated the patient. But here the scenario is different. So once you complete the procedure. For the bilirubin, we don't require a reversal dose, so there is no reversal because it is there is no antibodies for the bilirubin. So we will not we don't require a reversal any medication to neutralize the bilirubin, because his life is half length, so it will automatically so guys, there is no reversal dose for bilirubin. Once the procedure completed, we give blood products, clotting factors, and we shifted the patient to the CTICU for further managements, and there will be the close monitoring of the patient's appetite by the bedside nurses and by the doctors who is available in the CTICU.